All right, in this segment we want to talk about Medicare. Now, believe it or not, when you turn age 65, the whole world knows about it. And in that year, you're going to get inundated with all kinds of mail. You may even have people showing up at your doorstep to talk about Medicare. But what is happening here? Well, with Medicare, you qualify at age 65, and you get what's called Part A and Part B. Now, Part A is simply hospitalization coverage. Part B is outpatient coverage. Now, you have to understand with Medicare, it's going to cover about 80% of the cost. But there's gaps in the coverage. We'll call that just, the 20%. And if I want to get those gaps covered, I'm going to have what's called a supplemental plan. Okay, something that's just going to come alongside Medicare Part A and B, and it's going to fill all those gaps so that I can have closer to 100% coverage, okay? Now, what a lot of people don't understand is there's two different routes you can go. Okay, one route you can go for supplemental insurance is what we call the Medigap route. Okay, now this is government regulated. There's a number of different plans. They go from A to Z, and some are in force, some are not in force, some come and go. But you have to understand, with all these plans, they're all regulated. So for example, if I have a Medigap Plan K, then that's going to be the same for everybody. There's going to be no difference. So it's a lot simpler in that regard because I know what my coverage is going to be. Now, one of the disadvantages to having a Medigap plan is that I have to get what's called prescription, drug, or what they call Part D, has to be a separate plan. Okay, it's not included in my Medigap plan. The other thing that's not going to be included in my Medigap plan is maybe dental insurance. If that's something I want, then that's going to have to be a different plan. Now, one of the other disadvantages with a Medigap plan is, although they're all regulated, they have to be the same. No insurance company has to charge the same price. So this is something that on a periodic basis you're going to want to get shopped, because if I've got Part K, let's say I got a Medigap Plan K with one insurance company, but with another insurance company the same exact plan might be cheaper, then I'm going to want to know that, right? So a lot of people, they get their plan and then they never look at it again, and this is really something that every so often should be shopped. No different than your home insurance or your car insurance, to see if maybe you can get a cheaper amount. Now here at Centennial Wealth, we actually do this for our clients. So they'll come in with their plan, we'll shop it for them, we'll show them where the best rates are. So if that's somebody like you and you haven't had somebody look at that in a while, then you're going to want to give us a call. Now, the other route you can go is what's called the Advantage Plan route. Okay? Now again, this is just supplemental insurance. Now, why they call them an Advantage Plan is simply this. It has all of these. It has eye and dental, it has prescription, all rolled into one plan. But the disadvantage is it's not regulated. They don't have to be the same. So I can have one Advantage Plan with one insurance company and have another one with another insurance company, and they're going to be completely different. This kind of goes back to when we used to have to shop our health insurance, right? Blue Cross's plan might not be the same as Priority's. And so we had to compare those plans to see, not only from a cost standpoint, but we had to see what the coverage was to see which one kind of made the best sense for us. So you got these two different ways to go, and what's best for you is going to be determined on what kind of coverage you want. If you're going to be a traveler, you're going to be somebody maybe traveling around, and you want out of state health insurance coverage, maybe another doctor's plan, then depending on what route you go, that could be a big difference. What if I'm somebody that travels out of country? What kind of a plan do I want that might cover that? So a lot of it is going to be based on your lifestyle, but it's something that you want to be able to check into. So I encourage you, if you're somebody that's got a plan out there, hasn't been looked at in some time, and you think maybe you might be somebody that might be able to save some dollars, then give us a call. We'd be glad to give you a quote.